In 2019 and 2021, Elsevier carried out 2 global surveys with 3,715 physician participants to answer questions about physicians' use of online resources, one before the pandemic and the other at its height. The survey revealed interesting trends and changes in physicians' use of online resources and social media before and after the COVID-19 pandemic. This 4-part video series has been created to discuss those findings. In Chapter 2, we discuss why, when it comes to leveraging online resources, the majority of the physicians surveyed said credibility is key. Underpinning this general increase in the use of online resources, physicians cited the same reasons for their choices. In both 2019 and 2021, one of the top 3 factors affecting physicians' choice of resources was credibility, along with up-to-date information and ease of use. Elsevier had the opportunity to speak to physicians from different regions who participated in the survey to gain deeper insights into the other factors that help determine their use of online resources. For this chapter, we asked them to share their thoughts on credibility. We found that globally, 81% of physicians consider credibility as an important factor in choosing an online resource. The doctors shared their thoughts.
We have to do a medicine based on proven science. So credibility is indeed impossible for me. It's the first criteria when I seek for some news or for some information.
Whenever I am told of anything, the first thing I'd like to do, if I'm unaware of, is immediately type it into Google to identify its source of credibility. When we practice medicine, the most important credibility source is to look at the articles that we like to refer to look into the journals, to read the source of information, and that's how we actually make it a credible source of information.
As you can see, perceived credibility heavily influences physicians' choices of preferred content. Online medical journals were the most popular resources for physicians in both 2019 and 2021, with clinical reference portals and search engines like Google in second and third place.
I try to trust official sources of medical societies, which I think are not biased by private interests, and I trust news I can see in peer-reviewed journals, and I trust news that I can have in the best congresses.
Dr. Jonathan Silverberg agrees with his colleagues, but also emphasizes the importance of information accuracy.
Credibility is driven by evidence, and I want to make sure that I'm getting accurate information, no fake news, and the most correct, thorough, and up-to-date evidence on a particular topic that I'm looking into.
Our 3 on-camera participants and physicians in the 2 surveys also said that they often turn to national and international physicians' guidelines for the latest information. 78% of physicians used national guidelines as a source of medical information in 2021, and 59% used international guidelines.
When you have a field that has a lot of innovation and you have a lot of new therapies, you really need guidelines that are in step with that can keep up with that and provide that kind of reference to clinicians.
In order to deliver the best possible patient care, physicians are under enormous pressure to stay up to date. The physicians surveyed indicated that credibility is a key factor when it comes to staying well informed of new medical developments in their specialty. Most physicians looked to content like treatment guidelines, 89%, medical journal articles, 89%, online CME, 72%, and clinical trial information, 66%, as these sources are seen to be the most credible.
Medicine cannot be what it was 10 years ago. We keep learning and we have to fall back on the medical journals.
After credibility, 78% of our physicians cited up-to-date research as the second most important factor when choosing an online resource. So, when choosing online resources, the most important factors are credibility and timeliness of the information. Now that you know more about why credibility is so important when physicians access relevant online information and resources, please join us for our next chapter, The Importance of Connection, where we will discuss the importance of staying connected and how that changed from in-person interactions to online connections, largely due to the pandemic. For additional information or for our complete white paper report, you can always contact the Elsevier Pharma and Life Sciences Solutions team.